Hi, my name is Lori Lill, and I am one of the three instructors for this summer for population health. I've been teaching it for several semesters and had the fortunate opportunity to work with Mrs. Lockett, who is the lead professor. She has been the lead for several semesters and has done some wonderful work in improving and continuing to improve the course to make it more student friendly. This is my course introduction for myself, and we're going to talk a little bit about who I am, and then I'm going to talk a little bit about what my expectations of you are and what you can expect of me. So I apologize I'm a little bit late, and you can take a late fee off with me. How about that? To begin with, just to let you know a little bit about me, I'm located in Jacksonville, Florida. I'm not from Florida. I'm originally from a very remote part of Kansas. There was no library, fire station, police station, nothing. So we did have a school. We had a book bus that brought us library books, that kind of thing. So it was very, very, very remote. It's no longer that way. There are $1 million horse ranches out there, and you would never believe me if you saw it now. But I grew up out there in the 1960s. That's where I'm from. I got my first, oh, I'm sorry. As I live here in Jacksonville, I'm married. My husband also works from home. He is an MBA and works for GE. I have one son and two grandchildren, and they're both boys, and they live here in Jacksonville as well. And they are all boys. They are 6 and almost 2. Ronan and Liam, and the curse that I put upon them did not work for me, fortunately. They are perfect children for me, but they are not so perfect for my son. So, perfect curse. They're great kids, love them to death, love having them nearby, and love giving them sugar and sending them home. It's perfect. In addition to them, I have a Yorkie who is 14, and if you translate that into dog years, he's 101. So if you call me, you may hear him snoring. That's about all he ever does. He snores and passes gas. That's his dog. Yeah. He's in the high, frail, elderly doggy category. Um, that's a little bit about my personal background. My educational background, I was originally a diploma nurse. I graduated from Kansas City School of Nursing. Diploma nurse, if you're not familiar, I'm not positive, I need to look this up. I think it was the original way that they trained nurses. It's a 3-year program. The 2-year ADN programs became popular in the 1960s when they were trying to crank out nurses for the Vietnam War because people kept dying as soon as they got off the helicopter. Anyway, I was the second to the last graduating class of the 3-year program. I went on, obviously, and got my baccalaureate. I received my master's degree from the University of Iowa. My concentration was in acute care gerontology, patient education. And my clinical background has always been ICU, ER shock trauma, with a specific emphasis in cardiovascular surgical ICU. So that's a little bit about me. I have done lots of different things in my career. I've been a nurse for, sad to say now, I'm showing my age, a little bit over 30 years. I have worked a lot clinically, that's my favorite. Lots of education. Very brief management, not for me. I dabbled in clinical research, that's fun if you get an opportunity. Worked briefly for an insurance company, but primarily my biggest love is clinical and nursing education. So that's my background, and this class is a very interesting course, and one of the things that I want to talk to you all about are expectations. You are taking this in the summer. This is not what I would call an easy course. Mrs. Lockett has done everything she can to make it as user-friendly as possible. But you need to, at the beginning of this, I'm telling you this to help you. Look at the course and look at the percentages associated with each paper. There are two papers, the community assessment paper and the capstone paper. Those two papers are worth over 50% of your grade. And there are no formatives in this class. So what I would like to recommend greatly, and I can tell you I have kept statistics on this, and the students who work with me closely do much better. I can't take formatives from you, but I can take as many phone calls as you want. We can discuss your paper. You can show me a paragraph. We can make sure that you're getting transition sentences in, that you understand your APA, all of those things that you could lose points for, because it actually can drop your GPA. I had one student who it kept her out of going to grad school. She had to redo some things and to be able to go. So I'm not trying to frighten you. I'm trying to make you aware that you need to really focus and really look at what's coming and pay attention. Don't wait till the last minute to call me. Call me at the beginning. I'm available nearly 24 hours a day. And I don't mind phone calls. I have in my syllabus that you can call me from 9 a.m. to 8 p.m. If you want to schedule an appointment later than that, no problem. I will tell you that I have a cell phone and a text, but the text, I am 52. I know that some of you are much younger than that. I am not a good texter. I am much better on the primary phone. And I prefer the Canvas email so that we can follow each other's conversations through. But it is much easier for you to call me with your question, and I can explain it to you usually in less than 5 minutes. Where if you write me an email and I have to try and figure out what you're saying, and if I understand your question and I answer it and you don't understand my answer, then there's a lag time. And in a 16-week course, there isn't enough time. And I'm telling you, in the summer, there is not enough time. So please don't worry about calling me. I appreciate the phone call because I can accomplish it much quicker for you. Then I know if you understand, and I know where to point you. I know how to get the resources that you need. I can walk you through things that you need to do. So it's a very fun course, but it is not traditional in the sense that you're thinking of community health. It is population health, and we're going to go over that tonight, but it really is going to stretch your brain. It's taking you from concrete thinking to abstract. So you're not going to do your project inside the hospital. So let's just say, for example, your interest is congestive heart failure patients. Great, that's fine, but you're not going to look at them in the hospital where you work. You're going to go out and choose a community, and you're going to look at statistics and population. You're going to drive the community. You're going to talk to people in the community. You're going to look and see what's available for them to eat. Is there public transportation? And we'll go over all of this. But I'm just trying to get your mind set that you're not looking at them inside an institution, not in a nursing home, not in a hospital, but outside. It's a population. You're not thinking of them as your patient. It's not a community health where you're going on a visit. Your service learning hours are you going out and driving. You're driving down the neighborhood and you're saying, oh, is there a place for them to walk safely? No, there's no sidewalks. How could they walk? They can't. They have congestive heart failure and they can't walk very fast. They can't walk on the side of the road. They'll get hit by a car. So that's an issue. That's a gap. And so you're going to start to identify those things, and that will make sense as we go through the course. I just want to make sure that you understand at the outset that you are not going to be doing it inside your comfort zone. And that's the biggest piece to get through your head. It's not going to be unless you happen to work. There's one person I spoke with who works in population health. But unless you happen to work in population health, it's probably going to be a bit of a stretch for you. So I can tell you statistically, people who call me and conference with me, or Mrs. Lockett or Dr. Smith, will do better than people who don't. Now, I've had a few who do just fine on their own, but it's always, there's no reason not to call. You know, if you're doing fine, I'll say you're doing fine. You don't need to call me back. You know, nothing wrong with that. So that's my expectation of you, is that you and I, we have to communicate, because this is compressed down to 10 weeks. And so my job, you have hired me, is to make you successful. I don't know if any of you are old enough to remember the movie What About Bob? Just think of me about Bob. I am going to be Bob. I have all of your contact information, and if you don't call me, I will find you. So my job is to make sure that you are successful. And if you're not successful, it's not going to be because of me. So I want to make sure that you have the tools that you need and that you understand what to do. Now, if you choose not to do that, that's on you. But I am here for you 24 hours a day, honestly. I have no life. I'm just hired for you. I just sit here by the phone waiting for you. So that's a little bit about who I am, what I expect from our interplay throughout the summer. I just want us to be able to chat. I'm very friendly on the phone. I don't yell at people. I will assist you in any way I can. I will help you if you can't find your library searches. I will help you hook up with whoever you need to hook up with. So please utilize me. That's one of the best things about having an instructor, is that you can use them. So now is the time to do that. So I welcome you all to the course. It's actually, when it's all done, it's a very fun course. If you use your instructor, you will enjoy the course, because it actually is fun when you understand what to do. If you don't understand what to do, it is a nightmare. I've had students sobbing because they're just completely lost, where a 5-minute phone call in the beginning would have fixed it. So my phone numbers are all listed there. My phones are all working now, so you can call me. I also have a cell phone you can call me on. If I don't answer, leave a phone call. I will return the call usually within 24 hours, weekend or not. I don't care if you call me on the weekends. It's fine. I don't guarantee a 24-hour back, but I usually will. So I usually will respond in some way to let you know that I got the message, and then I'll do my best to get back with you unless I'm at a wedding or something. So welcome to the class. I think you'll enjoy it. We've got some great instructors. Mrs. Lockett is absolutely fabulous, and you'll get to meet her tonight. Dr. Smith is just energy bundled. So she's a great addition as well. So I'm looking for, a lot of you I know, sort of. I mean, I know we have not met, but I recognize a lot of your names, and I'm glad to see you again, because I feel like I know you, and I feel like we have rapport, and I hope that you feel comfortable from our previous exchanges to call me, and I'm telling you, you need to call me. So anyway, that's all I have to say. So I will see you all, whoever can come tonight. And to the one young lady who I made the joke of smearing her with marshmallow, that was just a joke. It's not a mandatory thing to go to these blackboards. We will record them for you. We will place them on, and you can listen to them again. Okay? So welcome, and anytime you want to call me, phone line's open. Welcome. And we hope you enjoy it as much as we do.